Thank you for joining us, Dr. Daragia.
Thank you, Liz. Hi, everyone. Thank you so much for taking your time to spend this evening with me. Hopefully it'll be informative and educational. Just a little bit about me. I'm from New Jersey. I was born and raised here. I've trained in New Jersey, New York, Pennsylvania. I've been in practice for about 15 years, and I spent a good portion of my time over at Hackensack previously, and then I joined Valley about 2.5 years ago. I'm trained in minimally invasive, which means I do a lot of my procedures laparoscopically or robotically. And most of my practice it's general surgery and bariatric or weight loss surgery. So, and under general surgery, I do a lot of hernias, a lot of gallbladders, pretty much anything in the belly, which means any small intestine, colon, and weight loss surgery. So that's me. But I'll be honest, I see a lot of hernias and gallbladders. So, but tonight's topic is hernias. So let's get started. I have no disclosures and no biases. So the topics we're going to go over regarding hernias is what exactly is a hernia, what causes a hernia, the different types of hernias, signs and symptoms to watch out for, how to treat hernias, the surgical options, and then lastly, the post-op care after surgery. So what is a hernia? It is an opening in the abdominal wall with abdominal contents protruding through it. Okay, so what does that exactly mean? So this looks very busy, but this is the abdominal cavity. Okay, this is your front side, and this is your back side where your spine is. But on the front side of your belly, there's multiple layers to your abdominal wall, okay, which I'm going to go into a little bit more detail. But basically, this front layer is the abdominal wall, and then inside your belly is the cavity where all your intestine is, okay? So to look at that in a little bit more detail, the outside, you have your skin, then you have some fat, then you have muscle, and then you have this thing called fascia, which is the deepest layer to the abdominal wall, which looks pretty thin on this picture, but it is the strongest layer of your abdominal wall, okay? And then under that is something called omentum, which is fat, which covers all your intestine. Everyone has it. And then right in the inside of your abdominal cavity is all your intestine down here, okay? So what exactly happens when you get a hernia? So like I went over on the other pictures, you have your skin, your fat, then you have muscle down here, and then you have this break in that fascia, which is that deep layer, and stuff from inside your abdominal cavity is protruding through. And that's what you see or feel when you feel for a hernia, okay? So what are things that cause that to happen? Some of the most common things, anything that puts pressure on your abdominal wall from the inside or increases your intra-abdominal pressure can cause a hernia. So things such as coughing, if you have a chronic cough and you have a vigorous cough, if you're always coughing, that increases the pressure in your belly. And that can weaken an area. Other things like straining because you're always constipated, right? If you're straining every morning, that increases the pressure in your belly. The other things are pregnancy, right? You have as the baby and the fetus grow, the uterus pushes on the abdominal wall. The other thing is obesity. The heavier you get, the higher the chance you can form a hernia. So everyone's center of gravity is by their belly button. So the heavier you get, the more pressure gets put on that area, all right? And that can weaken it. The other thing is exercising. And I don't want to say exercising is a bad thing. So that is not true. Exercising is excellent. But if you do a lot of core exercises, which is to help build your abdominal wall, there are times if you're doing a lot of core that you can weaken a certain area because there's constant pressure when you're exercising and you can create a hernia. The other thing is it could be congenital, meaning that you are born with a weakened abdominal wall, which is common. We see it in kids also. And then lastly is if you've ever had a previous surgery and you have an incision, that area can be weakened. Okay, so a lot of people come in with something called an incisional hernia. So what are the types of hernias? The most common hernia is something called an inguinal hernia. It's in the groin area, okay? The second most common is an umbilical, which is at your belly button. The third one is your epigastric area, which I'll go over on all the pictures. An incisional hernia is basically a hernia that happens at an old incision site, like I went over before. A lot of people hear the word ventral hernia. Ventral hernia basically means any hernia that's on your abdominal wall on the front side. Okay, so which means any of these, incisional, epigastric, umbilical, those are all ventral hernias. Some of the more less common ones are these bottom ones. I'm just briefly going to touch on them throughout the seminar, but something called a hiatal hernia, a Spigelian hernia, a flank hernia, and a lumbar hernia. And I'll go over those in a little bit more detail. But the first one is an inguinal hernia, okay? This is the most common. And that is basically anything in the groin area when you see a bulge, and it could happen after anything. I've had patients come see me for various reasons. You know, they lifted something, they moved something, they were just exercising, they were golfing, whatever the reason is, they notice a lump either at that moment or later in the day. Okay, and what's basically happening is what I went over before is the abdominal wall, there forms a weakness and stuff from inside the abdominal cavity is protruding outward, okay? The second most common one is the umbilical hernia. And that is right at the belly button or right around the belly button area. Some people think that having an outie is their normal, but that usually is a small hernia. And you can see again, stuff is, you know, poking through that fascia, and that's why you get an outie or anywhere around it. One of the other ones that I mentioned earlier is something called an epigastric hernia. And that is really, it's just a fancy term because of the location of the hernia. So this is your belly button. And if you had a hernia here, that would be an umbilical hernia. This is an epigastric hernia. Up here is your breastbone. And right below it somewhere, if you see a protuberance or a lump there, that's an epigastric hernia. So just to recap real quickly, this is a belly button hernia at your belly button area or an umbilical. And then an epigastric hernia is up higher. So I wanted to, another type of hernia is something called a Spigelian hernia. So we went over umbilical hernia, we went over epigastric hernia. Now you can see on this diagram that this is your muscle, okay? This is your rectus muscle. Your rectus muscle is what most people, when they're exercising, they're trying to make into their six-pack, all right? And this is right down the middle. But at the edge of this rectus muscle, you see this white line right here on both sides. You can get a hernia along any of this area on both sides, and that's what a Spigelian hernia is. It sounds really fancy, but it's really just the edge of the rectus muscle. So we just went over a belly button hernia, which is an umbilical hernia. This is an epigastric hernia, a little bit higher. The Spigelian hernia is at the edge of your rectus muscle. And then we have the inguinal hernia, which is in the groin area, okay, which is the most common. A femoral hernia is also in the groin area, okay? And that's something for when you see your doctor or your surgeon, that's for them to figure out what kind you exactly have, because they both usually present in very similar ways. So other types of hernias which are less common. Let me see if I can move this a little. So this is a flank hernia. So this is your belly, here's your belly button, and this is on the side of the abdominal wall. So flank hernias are not very common, but they can happen. And the most common reason is someone's had previous surgery in that area. And the most common previous surgery is usually something for the kidney, because most incisions are not made all the way out here. But the most common one would be for a kidney surgery. And then, like I said before, it would be an incisional hernia because then there's a weakened area because of a previous surgery. And that's the most common reason why people form a flank hernia. Now, the other one is something called a hiatal hernia, okay? I'm not going to get into too much detail about this because I'm sure there's other seminars on this. But hiatal hernia is, so this is your chest area, okay? And up in your chest, you should have your lungs and your heart. And then it's separated from your belly or your abdomen by this muscle, which is your diaphragm, okay? And below it should be everything that should be in your abdomen, which is basically your stomach and all your intestine, okay? But to get from your chest into your belly, there is an opening here, what we call a hiatus. And that hiatus is where food goes through, right? You eat food, it goes through your esophagus and into your stomach. But if that hiatus gets weakened or enlarged, then what can happen is part of your stomach or your intestine can slide up into your chest. And that's what a hiatal hernia is. And most people have a lot of heartburn or reflux when that happens, okay? Like I said, I'm not going to go into too much detail because that's a whole nother procedure on its own. But just so you know what a hiatal hernia is. And then the last one I'm going to discuss is a lumbar hernia. This looks like a fancy diagram, but basically now this is on the back side, okay? So this is not on your belly, this is on your back. So if you're standing in the back of someone, this is their spine. And then right here is their hip bone, or what we call their iliac crest. So if you took your hands and put them at your waistline, you feel the bone that goes to the backside. That's that iliac crest. And right above that iliac crest, away from the spine, you might feel a lump, and that potentially could be something called a lumbar hernia. Okay, so just keep that in mind. So now, what are the signs and symptoms? The most common thing is you physically see it, okay? You see a lump or you see a bulge. It wasn't there before, and now you see something. That is most likely a hernia. A lot of people do get pain or discomfort, or initially when they feel it, they have the pain or discomfort, and then it subsides for a while. But that could be a hernia also. You can also get pain or discomfort from a muscle pull, right? So it's really important that you see either your primary doctor or a surgeon to see and have someone diagnose whether it's just a muscle pull versus it's a hernia. Some people can get nausea or vomiting, right? That could be a result of either just pain is giving you the nausea vomiting symptoms, or you do have to worry that a hernia has intestine inside of it, which is causing a blockage, and that's why you're getting the nausea vomiting, okay? Other things to watch out for, it's worse with activity, or it gets better when you're laying down. Now, the reason why certain hernias get better when you're laying down is gravity tends to push whatever pushing through the hernia back into your belly, which is where it should be, and it relieves the pressure, and that makes it feel better. So if you see a lump and then you lay down and it goes away, then more likely than not, you probably have a hernia. The other thing you have to watch out for is skin color changes over the lump, which means that it's becoming more chronic, or what we call incarcerated or strangulated, which I'll go over in a few minutes. So what are the treatment options? The options are you just watch, okay, conservative management, you just watch and wait and see what happens. My recommendation would be that if you see any of those symptoms or signs, though, that you see your primary care or you see a surgeon to determine or decide if you should watch and wait or you should have it taken care of. Don't dismiss it, okay? So that's the conservative management. The other option is surgery. And now the most common reasons why you want to fix a hernia is one, because they're uncomfortable, they're giving you discomfort, or they're hindering your daily activity, right? You want to exercise, you want to be more active, and it stops you, or every single time you go to lift something, it bothers you, you want to play golf, whatever the reason is, it's preventing you from living your daily life, right? The other thing you have to know is once you form a hernia, they don't just go away. They won't go away because now you have this opening or this weakness. It doesn't just heal itself. With time, it will get bigger. So you should have it taken care of. And then the last thing is what you don't want to have happen is you don't want to worry that something important like intestine is going to get incarcerated or strangulated in the hernia. So when I went back to the initial picture, on top of your intestine, there's a layer of fat. Now, if that fat gets into the hernia, it's not as dangerous, right? Or it's not as concerning, even if it is giving you discomfort. But if you get a loop of intestine or colon or something like that in the hernia, that can become more of an emergency. And if it becomes incarcerated or strangulated, then it truly is an emergency. So incarcerated means that the intestine gets into the hernia, it gets trapped in there, you can't push it back in. That's what we call incarceration. Now, strangulation is the next step after that, where it gets incarcerated, but it's so tightly squeezing that intestine that the intestine starts losing its blood supply and it starts dying. So all of those bottom two really truly become an emergency. So that's what we don't want to have happen. So the options for surgery are you can have surgery with an open incision, right? Which is the previous way of doing it. Some surgeons still perform that. It's done with one incision exactly over the hernia area, okay? And this can be repaired with or without mesh. It really depends on multiple factors, meaning like what's in the hernia, how big is the hernia, what are your previous medical problems or previous surgeries. There's multiple reasons which determine how you fix a hernia open, okay? Nowadays, and more commonly, a lot of them are done laparoscopically or robotically, which is through the smaller incisions. And it's really because there's really a lot less pain with the laparoscopic robotic approach. It's a faster recovery. The thing you do have to know is if you have it performed laparoscopic or robotically, it is performed with mesh. There's no way to not do it without mesh if you have it done that way. Now, this is just to kind of give you a sample of what an open incision would be. You just make an incision over the hernia area. And laparoscopic means you're doing it with 2 or 3 little incisions with the camera and some tools, okay? So what are we basically doing? So the hernia surgery, so this is your abdominal wall again. This is the hernia, right? Protruding through the abdominal wall. And basically when we do surgery, we take whatever's in the hernia, we're trying to push it back in, close the area up, and then we reinforce it with a piece of mesh because that really gives you the strongest repair for any kind of hernia. And it's a dual reinforcement because 1, you're closing it, and then 2, you're reinforcing it with the patch. So since it is a surgery, right, it's not risk-free. There's risks involved, right? 1, it is done with general anesthesia. You are completely asleep for it. There's always a risk of bleeding, infection, scarring, which is pretty much for any procedure we do. There's always a risk that you can injure the intestine. There's a risk of the mesh getting infected, right? The mesh is a foreign material. It's not made out of human material. It's similar to, you know, anyone getting any kind of other procedure, like if you were getting a knee replacement, you know, it's a foreign material that's getting placed in there. Other things you have to know, the larger the hernia or the longer you've had it, the higher the risk of complications, just because it just becomes a more complex surgery, the bigger it is, or the longer you've had it, the more scar tissue it forms on the inside. And then there's always a risk of recurrence. Whether you do it with or without the mesh, there's always a slim chance of recurrence. A little bit less with the mesh. And then all of these are minimal risks, but you have to know about them, okay? So some things that most people have questions about are what happens after surgery. So after surgery, things you have to know. 1, it's usually a same-day surgery. You come in, you get it done, you can go home that same day. We expect that you're walking around same day, and I encourage my patients. I tell them every 2 hours after surgery, get up and walk around. The worst thing you can do is go home, lay in bed or on the couch. It really decreases the healing. The other thing is no exercising or heavy lifting more than 10 to 15 pounds for 6 weeks. Because most hernias, right, you're closing the area or you're patching it with the mesh, and it takes 6 weeks to heal all of that. Because all of this is going to become your new abdominal wall. The other things you have to know, no soaking in a tub, no pools, no saunas for 6 weeks. You can shower starting the day after surgery. And I usually recommend my patients no long distance traveling for 4 weeks after surgery. I usually have my patients follow up with me 10 days after surgery, and usually at 5 to 6 weeks after, Because at the 6-week mark, then I want to go over with you what you can and cannot do. At 6 weeks, you can start gradually exercising. Meaning, and I always say, try to do more cardio type stuff, meaning, you know, speed walking, jogging, bicycle, elliptical, light weights, that kind of stuff. The core exercises, which is the exercises that put the most pressure on the abdominal wall, which is sit-ups, push-ups, planks. I usually tell my patients to wait until week 10 to do that. So how does the process work? The process is, if you feel like you have any signs or symptoms, a bulge that you're seeing, you should really reach out to your primary care doctor or see a surgeon to determine if anything needs to be done. If you see your primary and your primary says you should consult with a surgeon, you should see, you should follow up with a surgeon. If I see you in the office, I go over everything with you, meaning I want to know your past medical history, what surgeries you've had done, what medications you're on, allergies, family history, everything. And then we go over a plan, right? We decide together what the appropriate next step would be, whether you should have surgery, whether you shouldn't have surgery, should you have it done laparoscopically, should you have mesh used or not used, right? But if we decide to proceed with surgery, most of our patients will need routine blood work and possibly an EKG, depending on your age and your history. And then depending on your age and your history also, most patients will need a letter or a clearance letter from their primary care doctor. And then you may need one from another specialist, such as a cardiologist, a pulmonologist, a hematologist, all depending on what your history is. Okay, and then all the procedures get done at Valley Hospital in Paramus. And that's really it. I thank you for